Welcome to this training on Canvas 2.0. Canvas, as most of you know, is the electronic or software version of the Virginia Child and Adolescent Needs and Strengths, or CANS, assessment. Canvas was launched on July 1, 2009, built on CANS software created by the state of Indiana and a software vendor, RCR Technology. So here we are 7 years later, and it's time for a change. I'm M. Parenti, the Foster Care Program Manager with the Virginia Department of Social Services. I'm here today to talk about the DSS Enhanced CANS, why and how revisions to CANS will make its use more meaningful in your everyday work with children and families in the child welfare system, particularly for children in foster care. One significant change to Canvas is that there are now two versions of the CANS for use in Virginia, one for children served by the local departments of social services, referred to as the DSS Enhanced CANS, and the second, the standard CANS, for all other users. So why do we have a DSS Enhanced version? The DSS Enhanced version of the CANS is the end product of a number of years of collaborative work between the Virginia Department of Social Services, local Department of Social Services reps, and the Office of Children's Services. The work began as part of Virginia's three-branch institute, which was an interagency effort intended to promote the well-being of children in foster care. In particular, the group wanted to look at assessment and had a goal of strengthening the use of CANS for children in foster care. They had a goal of making CANS more meaningful for child, family, worker, and supervisor as an integral tool for implementing Virginia's Children's Services practice model. They also wanted to provide the information from CANS to the LDSS to assess progress and outcomes for children in foster care and families. We began the process by looking at the federal recommendations and requirements around the use of functional assessments in child welfare. Federal recommendations include that the tool must be standardized, valid, and reliable. The assessment is to be made on multiple domains of social-emotional functioning, and the assessment is to be administered periodically to assess changes over time. This facilitates the adjustment of services based on a client's progress. It permits the evaluation of the effectiveness of particular vendors or services, and it generates knowledge about the effect of maltreatment and trauma and evidence of effective treatment. The federal government requires that states screen for and treat trauma associated with maltreatment and removal, and also that states address mental health needs for children in foster care. The CANS meets all of the federal recommendations and requirements and is already the required CSA uniform assessment instrument in Virginia. A CANS work group was formed to specifically look at CANS and to make recommendations about modifications to include additional content of value to family service workers, which would enhance buy-in through greater return on investment while retaining the integrity of the CANS as a cross-systems tool. The work group was to recommend specific reports useful to family services staff, to discuss and make recommendations about improving CANS-related training and integration of CANS assessment activities into DSS policy and guidance, and to assist with the development of the new foster care service planning process by the integration of CANS into service planning. The CANS work group had representation from the Virginia Department of Social Services, the local departments of social services, and the Office of Children's Services. Each group provided important perspectives about what would result in an improved product and practices. All of the work was guided by the visions, goals, and priorities of the League of Social Services Executives, the Virginia Department of Social Services, the Three-Branch Institute, and the Office of Children's Services. Revisions to the CANS include the addition of a child welfare module, which includes items of specific relevance to this population. It also includes an enhanced trauma module and several DSS-specific reports. Other broad-based enhancements to improve overall user functionality and reporting capabilities for all CANS users is included. The benefits specifically of the DSS enhanced CANs for the local departments are that there are two reports that can be used. One is a comprehensive child assessment report, and the other is a permanency report, which addresses the capabilities for permanence and protective factors of caregivers. The integration of the CANS information into the service plan will ultimately happen in OASIS, although that is not currently possible. The service plan screens will include an opportunity to enter information from CANS at some point in the future. One of the other things about the DSS Enhanced version is that it's possible to assess more than one caregiver at a time to support concurrent planning. And finally, the outcomes that we're going to look at are the reduction or increase in trauma symptoms, the increase in parental protective factors, whether a service is working, and allows us to do better service provider evaluation. As of July 1, 2015, our foster care guidance requires the use of CANs for all children in foster care, not just those served by CSA. This is to enable us to collect data about all kids in foster care and their progress over time. With the release of Canvas 2.0, all DSS referred cases will employ the DSS enhanced version of CANs.